Okay, this is a new, it's a new concept, very important concept. Inshallah, you may encounter in your practice. If you encounter, it will be a emergency situation. Understand? So this is very important concept. Please understand. If you face something like this in your clinical practice, especially in dental practice, it will be of emergency situation. Understand? So keep that in your mind, and please concentrate now. This is about a concept called hemostasis and thrombosis. Okay, so inshallah after this lecture you can able to define the hemostasis, thrombosis and embolism, and you can explain the mechanism involved in thrombus formation and describe the various morphological appearance of thrombus and what happens after the thrombus. Okay, so this is a simple mechanism which they would have taught you in the you would have learned from the physiology. Okay, so let us discuss in detail now. See, there are mechanisms, and please stop talking. Actually, it's the session is getting recorded. So there are mechanisms involved in formation of blood clot. Okay, there are some mechanisms involved in formation of blood clot, and there are mechanisms involved in diluting the blood. Okay, they will not allow the blood to clot. There are some mechanisms involved to make the blood clot. There are some mechanisms involved not to make the blood clot. Okay, so if the mechanisms involved in blood clot is decreased, or if the mechanisms involved in the blood which will not allow them to go for clotting, if it is increased, then you will get bleeding disorder. Then you will get bleeding disorder. If the mechanisms involved in the blood clot is increased, and if the mechanisms which will not allow the blood clot is decreased, then you will get thrombotic disorder. Then you will get thrombotic disorder. Actually, I just made a Google translation. Okay, I don't know how far the translation is correct, because this is very important. So that's why I'm putting in the translation here. Okay, so please understand why I'm doing this kind of thing. I'm taking this kind of steps for you people to understand this. In dental practice, something I'm teaching to medicine is something different. This concept we teach in a different way. But for dental students, why I'm putting this kind of approach to explain this concept is, if you encounter this, it will be emergency. Understand? So that's why it is related to the life and death of the patient. Okay, so that's why I'm putting maximum effort for you people to understand. Okay, so now let us discuss about certain basic principles here. Hemostasis means, it's not homeostasis, don't get confused. Hemostasis means something in our body, there is a mechanism which allow the blood to be in fluid state, which makes the blood to be in fluid state. Okay, blood is a fluid, right? Okay, blood is a fluid, because then only the blood can circulate. So in other words is keeping the blood in a clot free state. Keeping a blood in a clot free state. You all understand this? In normal vessel. Okay, if the blood vessel is normal, you all know the blood vessel is lined by endothelial cells. Okay, this endothelial cells sits on the basement membrane. They sits on the basement membrane. They sits on the basement membrane, and below the basement membrane we have small thin connective tissue. Okay, then depends upon the what type of blood vessel, they have elastic layer or not. Okay, and they have smooth muscle, right? This all we already discussed, right? They have layers of smooth muscle. Any doubt in this? You all know this, right? Okay, this is the smooth muscle. Now the blood vessel is not damaged, the blood vessel is normal. The blood vessel is normal. If the blood vessel is normal, the blood should be in a fluid state. The blood should be in a fluid state. Then only the blood can circulate, right? The blood should be in a fluid state. Okay. And you all know, in the center of that fluid, the cells will be running, right? Center of the fluid, the cells will be running. So we have cells here. This is called laminar flow. This is called laminar flow. This is endothelial cells. Okay. Okay, now you all know that the blood vessels are normal. If the blood vessels are normal, the blood should be in a fluid state, which means clot-free state. Which means clot-free state. Okay. If the blood vessel is damaged here, if the blood vessel is damaged, immediately the blood will go for, usually it will leaks, right? It will bleed. After that, immediately the blood will go for clotting. The blood will go for clotting. You understand? If the blood vessel is normal, the blood will be in a fluid state. If the blood vessel is damaged, injured, then the blood will go for clotting. The blood will go for clotting, become solid. The blood will become solid. So the blood has two properties. One is to keep themselves in a fluid state if the blood vessel is normal. If the blood vessel is normal. If the blood vessels are damaged, then they have another property to become a clot. To become a clot. So if the blood has these two properties, then it is hemostasis. Then it is hemostasis. So hemostasis means keeping the blood in a fluid state when the blood vessels are normal. When the blood vessels are normal. And if there is injury, then there will be rapid formation of clot. In pathology, the clot is called as hemostatic plug. The clot are called as hemostatic plug. Okay. So this is the basic principle you should not forget in your life. If the blood vessel is normal, the blood will be in a fluid state. If the blood vessel is injured, for example, you are removing the teeth, which means you are rupturing the blood vessel below the teeth, right? So then after that it will clot immediately. If the teeth is there normally, the blood will not be clotted there, right? Because the blood vessel is not damaged. Okay. If the blood vessel is damaged, then immediately the clot forms. If the person, you are removing the teeth, if the clot is not forming, what happens? It will keep on bleeding. It will keep on bleeding. So that is a bleeding disorder. That is a bleeding disorder. Okay, you understand? Okay, now if the blood vessel is normal, then if the blood is going for clot, it is normal or abnormal? It is abnormal. That is called thrombosis. You all understand this? So abnormal clot formation is otherwise called as thrombosis. Abnormal clot formation means what? If the blood vessel is normal or it is small injury. For small injury and all, the blood vessel will not go for clotting. So if there is minor injury or normal blood vessel, if the blood clotting is happening, okay, so here the blood vessel is normal, right, in this area. So now the blood is going for clotting, okay, it is called thrombosis. Understand? So if the blood vessel is clot is forming, if the blood clot is forming in an uninjured vessel or minor injury, then it is called thrombosis. Okay. So hemostasis or thrombosis, whatever it may be, it is a clot formation. See, in the hemostasis, if there is a injury, the clot will form. In thrombosis, without injury, the clot forms. Understand? So for formation of the clot, we need three things in the blood vessel. One is we need blood vessel wall. We need platelets, and we need clotting factors. We need coagulation factors. Okay, clotting factor. These are the three components needed in the formation of thrombosis or normal clot formation. You all understand this? Okay, now consider there is a injury. Consider there is a vascular injury. So once this is a blood vessel, okay, now there is a break in the blood vessel. There is break in the blood vessel. Okay, some damage happens here. Okay, some damage happens here. So immediately what happens? First response is vasoconstriction. First response is vasoconstriction for very short duration of time. For very short duration of time, that is due to endothelial cells produce a chemical substance called endothelin. Okay, endothelial cells. These endothelial cells produce the, once there is injury, for example, you are having a blade cut. Immediately when there is cut in the blood vessel, the surrounding endothelial cells release a chemical substance. What is the name? Endothelin. This endothelin. This will produce small period of vasoconstriction. Small period of vasoconstriction. Understand? But it is very short duration. Okay, it is very small period of time. Okay, there is a vasoconstriction. So next step is, you all know there will be bleeding. There will be a bleeding. Second step is there will be bleeding. So third step is, when the bleeding is happening, when there is blood vessel is cut, you know the blood vessel, you all know endothelium sits on the basement membrane. Now the basement membrane is exposed, right? Basement membrane is exposed. The basement membrane has some gum, sticking substance, has some sticking means, you all understand, gum like substance. Okay, so that substance is called von Willebrand. You have to memorize Willebrand factor. The substance is called von Willebrand factor. Okay, so that substance is there in the basement membrane. That substance is there in the basement membrane. So now there is an injury, the basement membrane is exposed. Basement membrane is exposed. The first step during the injury is, first there is an injury, first step is vasoconstriction. That vasoconstriction is due to endothelin. Due to endothelin. Second step is, there is a exposure of basement membrane. Exposure of basement membrane. Then what is exposed? Von Willebrand factor is exposed. Now the bleeding is happening, right? Now the bleeding is happening. You all know platelet, right? The platelet comes and attaches to the von Willebrand factor. The platelet comes and attached to the von Willebrand factor. If one platelet is, see, you all know platelet is round shaped. Platelet is round shaped. Once it attaches, it becomes flat. It becomes flat. You all understand? So the platelet changes its shape. The platelet changes its shape. It becomes flat. Once it attaches with the von Willebrand factor, they bring all the platelets. They invite all the platelets, and all the platelets will come. They form a first clot. You understand? They form a first clot. It is made up of platelets. It is made up of platelets. It is called primary hemostatic plug. It is called primary hemostatic plug. It is platelet attaching to the von Willebrand factor, that leads to platelet aggregation. Platelet aggregation means what? Bringing all the platelets. Bringing all the platelets. So this is called primary hemostasis. That is called primary hemostasis. Okay. For example, if the person is having platelet deficiency, what will happen? This clot cannot form. If the person is having less platelet, this clot cannot form. Or the person is taking some drug that will not allow the platelet to come closer. That will not allow the platelet to come closer. There are some drugs we give to the patients that will not allow the platelet to come closer. So if you give if the person is taking the drug and you are removing his teeth, what will happen? This platelet clot cannot be formed, the person will have bleeding, severe bleeding. Understand? So this is the concept here. Once there is injury, then there is a bleeding. Okay, so before that there is a vasoconstriction. Small period of time there is a vasoconstriction because of endothelium. Because of endothelium. After that, subendothelial zone is exposed. Von Willebrand factor is exposed. Then platelet goes and attaches there. The platelet goes and attaches there. Once it attaches, it changes the shape. It becomes flat. It is very, very important. It becomes flat. Then it invites all the platelets. Then all the platelets will come and they form the first clot. It is made up of platelets. It is called primary hemostatic plug. It is called primary hemostatic plug. Okay, now there is a vessel injury. So now the von Willebrand factor is exposed. There is a injury. Now the von Willebrand factor is, what will happen? The platelet loves von Willebrand factor. They will come and attach. Understand? Once they attach, they become, see now it is round. Okay. Once it attaches, it becomes flat. It becomes flat and it forms a primary hemostatic plug, platelet clot. It forms a primary hemostatic plug. So if anybody is having less platelet, it cannot be formed. If anybody is having drugs that will not allow the platelet to come closer, then it will not form. Understand? So the person will not have the primary hemostatic plug, then he will keep on bleeding. He will keep on bleeding. Okay, once the platelet clot is formed, primary hemostatic plug is formed, immediately in the blood we have clotting factors. We have clotting factors that gets activated. So now we have a inactivated clotting factor. Once they see the platelet clot, then they become activated clotting factor. And then the clotting factor acts like a cement. You know cement? They act like a cement. It's a protein and they go in between the platelets and they form a very strong clot. Okay, it is called secondary hemostatic plug. You all understand? It is called secondary hemostatic plug and it is because of the clotting factors and it acts like a cement which cements the platelets. Okay, so this is secondary hemostatic plug. Okay, so let us take one more situation and there is a injury here and what is exposed? Subendothelial zone is exposed. Then immediately the platelet comes and attaches. Okay, they become flat and they form primary hemostatic plug. Then clotting factors gets activated once they see the flat shape of the platelet. Then they form a cement like attachments. Okay, and they form secondary hemostatic plug. Okay, secondary hemostatic plug. If anybody is having clotting factor deficiency, do you think this can happen? No. This cannot happen. Okay, so or anybody is taking drug that will not activate the clotting factor, do you think it can happen? So the patient will go for bleeding. Understand? So this is about primary hemostasis. It is about hemostasis. So we have two concepts here: primary hemostasis and secondary hemostasis. Primary hemostasis is by platelets. Secondary hemostasis is by activation of clotting factors. Understand? So if there is no clotting factor or clotting factor is deficient or somebody is taking drug that interferes with the clotting factor activation, that will spoil the secondary hemostasis. That will spoil the secondary hemostasis. If the person is having platelet deficiency, or the patient is taking some drugs that will not allow the platelet to come closer, that will lead to primary hemostatic disorder. That will lead to primary hemostatic disorder. So we have hemostasis, that is primary hemostasis and secondary hemostasis. Primary hemostasis is by platelets, secondary hemostasis is by activation of clotting factors. Okay, so primary hemostasis is depend on platelet and platelet aggregation. Okay, secondary hemostasis is depend on clotting factor and activation of clotting factor. Understand? So we have two types of disorder: primary hemostatic disorder, secondary hemostatic disorder. Primary hemostatic disorder comes in platelet deficiency, or anybody is taking drug which not allow the platelet to come closer, okay, which stops the platelet aggregation or which inhibits the platelet aggregation. Second group of disorder is secondary hemostatic disorder. Some child has clotting factor deficiency. Okay, so if any child comes and the child has a clotting factor deficiency, if you remove the teeth, the child will keep on bleeding. The child will keep on bleeding. Or any old man comes, he is taking a drug where he cannot able to make the activation of the clotting factor, then he will keep on bleeding. Understand? So it is very, very important. Okay, so once the clotting is formed, then there is another mechanism, that is a regulatory mechanism. Then blood vessels will heal, then the clot is removed. Then the clot is removed. That is called fibrinolytic mechanism. I hope in physiology they would have taken. That is called fibrinolysis. That is called fibrinolysis. Okay, so now there are certain roles done by certain components. So in the hemostasis, the role of endothelial cells in the hemostasis, first of all, endothelial cells should be intact, which means there should not be any gap and show the endothelial zone, subendothelial zone. If subendothelial zone is exposed, then the platelet will attach. The platelet will attach. So intact endothelial cell itself make the blood to flow in liquid state. Okay, so keep the blood in a liquid state. So if there is endothelial cell injury, then endothelial cells will release lot of cytokines, chemical substances that will produce inflammation, that can also lead to thrombus formation. So one of the chemical substances you should know is von Willebrand factor. Von Willebrand factor, very important one. So now coming to the role of platelet in hemostasis. Okay, so I told you girls that platelet comes and attached to the von Willebrand factor. Platelet comes and this is a von Willebrand factor. This is the platelet which attached to the von Willebrand factor. Okay, once it get attached, they release these substances ADP and thromboxane A2 that leads to platelet aggregation. That leads to platelet aggregation. If they have anything to block this substance thromboxane A2, then platelet cannot aggregate. The platelet cannot aggregate. Okay. Cell membrane is made up of what? For example, this is platelet. The cell membrane is made up of what? Mashallah, phospholipids. It is made up of phospholipids. And you all know clotting factors, right? To activate the clotting factor, we need phospholipids. We need phospholipids. So the platelet, why they becoming flat? Because they can show more phospholipid to the clotting factor. They can show more. See, when it is round, they cannot show more phospholipid. But it becomes flat, they can show more phospholipid. Understand? That is why the platelet is changing shape. That is why the platelet is changing shape. Yeah. So when there is a platelet is spherical, the phospholipid surface is very minimal. When the platelet become flat, the phospholipid surfaces become more. So more clotting factor can sit and get activated. Because for activation of clotting factor, we need phospholipid surface. We need phospholipid surface. So this acts like a surface for activation of clotting protein. Act like a surface for activation of clotting protein. Okay, now coming to the coagulation factors, clotting factors. You all know in physiology they would have taken about intrinsic pathway, extrinsic pathway, and the common pathway which involves in the secondary hemostasis. Okay, formation of secondary hemostatic plug. Okay, so you should know which factor activates the intrinsic pathway, which factor activates the extrinsic pathway. Inshallah, in the lab they will discuss more, because we do a test which can identify which pathway is wrong. Okay, Dr. Sylvester will take more. Okay, now coming to, so far we discussed about normal. So they are going to discuss about thrombosis now. Thrombosis means what? If the blood vessel is uninjured, the blood vessel is normal, and the blood clot forms. If the blood clot forms. Okay, so there is a person called Rudolf Virchow. So he said 3 reasons for it. One is there should be endothelial injury, or there should be alteration in the blood flow. Okay, the blood becomes slow or blood becomes very fast. Blood flow becomes slow or blood flow becomes very fast, or there is increased clotting factor, hypercoagulability. So there is increased clotting factor. Okay, so now let us discuss concepts now. Okay, now we'll take a blood vessel. Now this blood vessel is not injured. Okay, if the blood vessel is not injured, the blood flow is in the fluid state. The blood flow is in the fluid state. Now the person has a disease called atherosclerosis. Atherosclerosis means the person has more fat in the blood. That fat comes and deposit in the walls of the blood vessel. Understand? So if the fat is increased, more fat comes here. More fat comes here, then more fat gets accumulated and the blood vessel is narrowed. The blood vessel is, this is endothelial cells. The blood vessel is narrow. Now you can see full of fat here. You all understand this? Okay. The fat comes to the wall of the blood vessel and it gets deposited. So it is narrowing the blood vessel. It is narrowing the blood vessel. So what is happening is, here the lumen is narrowed. The lumen is narrowed. Okay, now let us take a pipe, water pipe. Now the water is coming, right? When you close the pipe in halfway, water will come fast or slow? See, you take a pipe, if you close the pipe in halfway, okay, the water will come very fast, right? The water will come very, we used to play like that, right? So water will come very fast. So here the water flow will be very fast. So same mechanism here. When the lumen is obstructed because of fat deposition, so this disease is called atherosclerosis. Atherosclerosis, fat deposition in the, lipid deposition in the blood vessel. So now the blood flow will be very fast or slow here? It will be very fast. When the blood flow is very fast, it is called turbulent flow. It is called turbulence means very fast. It is called turbulent flow. When the flow is very fast, that will damage the endothelial cell. That will damage the endothelial cell. Then subendothelial zone is exposed, or this endothelial can be damaged and subendothelial zone is exposed. Immediately clot formation happens. Immediately clot formation happens. So now the lumen is very narrow, even a small clot will obstruct. If the clot happens here, what will happen? The blood cannot go here. The blood cannot go here. It will produce ischemia. It will produce ischemia. Ischemia will produce hypoxia. It will produce cell death. That's what happens in the heart attack. Okay. The blood vessel supplying the heart, this thing happens. Understand? Once again I am telling. I am giving some examples so that you will understand the principle. Okay, for example, this is heart. Okay, heart muscle. Heart is keep on pumping, right? Heart muscle should have continuous blood supply, continuous oxygen. Otherwise, they will not get the energy, right? So now this heart muscle is supplied by one coronary blood vessel. The blood supply of the heart is by coronary artery. It is by coronary artery. Now this person is having high lipid. He is a hyperlipidemic patient. Okay, so now you all know this is lined by endothelial cells. Okay, and what happens, slowly the fat gets deposited. Okay, this happens from the age of from the age of 1. Understand? So fat deposition in the blood vessels happens from the age of 1. Understand? So that's why we have to maintain a normal fat. Okay, so if the fat is more deposition happens. More deposition happens. So this guy is having a lot of fat. So more deposition happens. Then slowly the fat increases, and which narrows the lumen. So lot of fat lakes are formed. Okay, now it narrows the lumen. What will happen to the flow here? It becomes slowly, it becomes fast. When it becomes fast, this can damage the blood endothelium. Okay, the flow can damage the endothelium. Immediately the clot forms. Then if the complete clot is formed, that is called thrombosis. This is called thrombosis. It is abnormal clot, right? It is called thrombosis. Then what will happen to the heart here? It will go for ischemia. Ischemia leads to hypoxia. Hypoxia leads to necrosis. So now this heart muscle is dying. This is called myocardial infarction. This is called heart attack. This is called heart attack. Understand? This is what happens in the individuals who is having heart attack. Understand? So this is called thrombosis. This is called thrombosis. Okay, this happens at the background of atherosclerosis. Okay, it happens at, this is called atherosclerosis. Okay, see, atherosclerosis is changing the blood flow. So alteration in blood flow can lead to thrombus formation, and atherosis, alteration in blood flow, is damaging the endothelium. So endothelial injury can form thrombosis. Okay, and some individual, this is another blood vessel. Okay, some individual, the endothelium blood vessel wall is normal, endothelium is not injured, but they have increased clotting factor, and they also have a tendency to activate the clotting factor without platelets. Okay, so they have some genetic disease, so where the clotting factor is always activated, what will happen? They will clot. So this happens when they have hypercoagulable tendency. This is called hypercoagulable tendency. So this also happens, for example, when the person is taking bed rest. I remove this. See, for example, the person is got accident, okay, and he is admitted in the hospital and he is in bed rest. So now it is his leg, okay, and inside the leg we have vein, right? This is the vein. Understand? See, if the person is not moving his body, the blood cannot circulate. Okay, calf muscle acts like a pumping machine. Understand? So it pumps the venous blood to the heart. Okay, if the person is not walking and he is in bed rest, so that's why we do physiotherapy to the patient. Okay, we keep on moving the patient. Understand? So otherwise what happens, the person is in bed rest, the blood is not circulating, the blood stays in the lower part of the body. So if the blood stays, what will happen? What is laminar flow? The cells should be in the center, right? If the blood stays more, the cells settle. Understand? If the cells settle, if the platelets comes closer, they will clot. Okay, platelets are very dangerous, they should not come close each other. If they come closer, they will clot. So here, because of stasis, this is called stasis. Because of stasis, the platelet coming closer and it forms a clot. Understand? So this happens in a long bed rest patient. This happens in the long bed rest patients, and this is called deep vein thrombosis. This is called deep vein thrombosis. It is otherwise commonly called as DVT, deep vein thrombosis. So that's why this patient will have necrosis here, okay, in the legs, ulcer, okay. So this is highly dangerous state, okay. So this is called deep vein thrombosis. Okay, let's go to the handout. So these are the three reasons for thrombus formation. One is endothelial injury, alteration in the blood flow, stasis or turbulence of blood, or blood hypercoagulability. So endothelial injury can happen in hypertension, because if there is more pressure in the blood, then that can damage the blood vessel wall, okay. So in hypertension, or in inflammation, or in toxin or metabolic products. Abnormal blood flow happens, I told one example, atherosclerosis. And if you know one example is enough. Then is hypercoagulability of blood happens. I told you that some people have more activated clotting factor. That disease is called factor 5 Leiden mutation. And if there is a bed rest, okay, the blood tendency to settle, so that will produce hypercoagulability. Or if there is tissue damage, massive tissue damage also cause hypercoagulability, and cancer can cause hypercoagulability. These three you should not forget. So one is bed rest, tissue damage. For example, the person got massive burn injury, okay. The burn injury can increase the hypercoagulability status. Burn injury can increase the hypercoagulability status, and some cancers will increase the produce clotting factors. Some cancer cells will produce clotting factors. So these are the three reasons for thrombus formation. So this is a normal blood vessel, for example, and if there is thrombus is formed, you can see the clot here. You can see the clot here. So what happens is, if we have a good fibrinolytic mechanism, the clot will be lysed. Clot will be completely removed. That is called resolution. That is called resolution. Or the endothelial, if the clot is small, the endothelial cells grow over the clot, and it is called organized thrombosis. Organized thrombosis. Or they produce this kind of lytic mechanism, and they produce canal. That is called recanalization. That is called recanalization. So in some individuals, this is the blood vessel, the thrombus is formed here, okay. It keeps on growing. It keeps on growing till the heart. For example, thrombus is forming the leg, it keeps on growing towards the heart, okay. So that is called propagation. That is called propagation. The thrombus is spreading. It is called propagation. Understand? And another thing which I am going to talk in detail is called emboli. Embolization. This is nothing but, see, this is the blood vessel. Now the thrombi is formed, okay. You know the clot is very soft one. It is very soft. Now the blood flow will be fast here, right? Then the thrombi gets break. The thrombi gets break, and it travels in the blood, and it goes in the circulation. It blocks somewhere. It blocks in the small vessels, okay. So this is called embolization. This is called embolization. The thrombus is formed somewhere, it gets break, and it travels in the blood, it blocks somewhere, okay. So this is called embolization. So this is called thromboembolism. This is called thromboembolism. And we have two types of thromboembolism: pulmonary thromboembolism, systemic thromboembolism, okay. And you all know this. Actually, I will explain it in 2 minutes. See, this is heart. This is right atrium, right ventricle, left atrium, left ventricle. Blood comes from the venous side to the, come on, you girls are sleeping. Blood comes from the venous side to the right atrium. From the right atrium it goes to the right ventricle. From the right ventricle it goes to the pulmonary artery. Okay, then it goes to the lung and it reaches the left atrium. Okay, then it goes to the left ventricle, then it goes to the aorta, then it goes to the arteries, then capillaries, then veins, right? This is circulation. Okay, now consider this is leg. Okay, and person got accident and or person got cancer and she is in long bed rest. Okay, now if there is person is in long bed rest, what will happen? The blood stays there. Okay, it is stasis. Okay, and now the platelets are coming together. Okay, and it forms a clot. This condition is called what? Deep vein thrombosis. It is called deep vein thrombosis. Now that this clot got breaks, where it goes? In the circulation, where it goes? It goes to the right atrium. From the right atrium it goes to the right ventricle. From the right ventricle it goes to the lung. In the lung we have lot of small blood vessels, pulmonary capillaries. It blocks the pulmonary capillaries. It leads to pulmonary embolism. It leads to pulmonary embolism. You all understand? If the thrombi forming in the systemic circulation, it forms pulmonary embolism. Okay, so if the thrombi forms in the systemic circulation, it gets break, follow the circulation. Okay, it goes to the right heart, then it goes to the lung, it blocks the lung capillaries. So it is a pulmonary embolism. So origin of thrombi is important. So if the person is having deep vein thrombosis, then he may go for pulmonary embolism. It may go for pulmonary embolism. Okay, for example, this person is having some valve disease and he is having thrombosis here. Okay, and from the left atrium to left ventricle the blood flows, right? So thrombi gets ruptured. Where it goes? It goes to the aorta, right? So now the thrombi is forming in the heart. The thrombi is forming in the heart. It is entering the emboli is entering the systemic circulation, and we have lot of capillaries supplying the brain, supplying the kidney. So it can go and block anywhere. It can go and block anywhere. So if the thrombi is forming in the heart, the emboli happens in the systemic circulation. It is called systemic emboli. It is called systemic emboli. If the thrombi forms in the systemic circulation, it goes and block the lung. It is called pulmonary emboli. It is called pulmonary emboli. Okay. Now this is all thromboembolism. This is all thromboembolism. Now you all know scuba diving. You all know or not? It's allowed here in South Jeddah. Scuba diving. Okay, type. So in scuba diving, what they do? The person goes to the deep of the ocean and comes back, right? Yes or no? Okay. When he comes back, if he comes very fast, okay, in his blood vessel, bubbles will be formed. Understand? That bubble can go and block the lung. Understand? So that is air embolism. That is air. You understand? Yes. Okay. So one is scuba diving. The person goes deeper, comes very fast from the ocean, and in his blood vessel immediately the bubble will come. This is all nitrogen bubbles. Understand? So this blocks the person's lung. Okay, it's very, very dangerous. Okay, it is commonly seen in the scuba divers. And another thing is, you all know the bone. The bone contains what in the center? What are the types of marrow? White. yellow and red. Red marrow produces the blood cells. Yellow is a fat. Okay, if the person got fracture, okay, got accident, this fat can enter the blood vessel and block the lung. This is called fat embolism. This is called fat embolism. This very commonly happens in the trauma. When the person going in the car, he got massive accident, so immediately the leg bone or long bone got fractured, okay, and he is taken by the ambulance, okay, and he is coming to the hospital, and immediately he has difficulty in breathing. Why? Because there is a fat from the bone escaped into the blood vessel. It is blocking the lung capillaries. Okay, so this is called fat embolism. This is called fat embolism. You all know amniotic fluid during delivery. You all know amniotic fluid or not? See, amniotic fluid is a fluid which covers the baby when the baby is growing. I don't want to go in detail now. Okay, so the membrane ruptures, the fluid comes out. Okay, then the baby gets delivered. Okay, so during the process of delivery, okay, the amniotic fluid, when it gets ruptured, the amniotic fluid contains lot of waste products, and it contains fat also. So, and it contains skin, debris, many things. So if that fluid enters the circulation, it blocks the lung. Okay, that is called amniotic fluid embolism. That is called amniotic fluid embolism.